Hello, my friends. Today I had a patient. She had fever, 39 degree, and she said I had 2-3 times diarrhea in last 2 days, and she didn't eat anything for 2 days already. Abdominal pain, which is periodically it's appearing, not it is too. It's rare for here, and except that she lost about maybe 10 to or 15 kilograms of the weight, and uh, except the area she had a tachycardia, hypotension, and that situation was a little bit strange for me. I was listening to the um, lungs, I mean about the auscultation, that she had some crepitations, some kind of very low diminished the lung sound, and it was not visible. So I was thinking about the diagnose. At that time I was at her home because I was on call, so I couldn't make a good diagnosis for her, but I was thinking about the oncology, and without any confirmation you can't just hospitalize a patient with oncology. That's why I hospitalized her with pneumonia, because she had some sign and symptoms of the pneumonia, but actually the exact diagnosis should be after the some other examinations like abdominal ultrasound, like ECG, so blood analyze, and some others. Uh, and the better thing it is to do for her, I think, it's to do MRI of the abdominal cavity, or CT scan. But anyway, the main thing for me, which it was interesting, it was the sign and symptoms, uh, and something else which is in the sign and symptoms which I found here. It is about the crepitation, why it causes the crepitation if the patient has oncology. So listen to this. When the serotonin it's increasing inside of the organism, actually when the patient has carcinoma of the appendix or ileum, the serotonin ratio is increasing. So this increasing in the serotonin causes the right heart failure and affecting on a tricuspid valve. So it causes tricuspid insufficiency, because multiple time when the right side of the heart is exposing to the serotonin, uh, it causes the damage to the myocardium and to the tricuspid valve also. That's why I think she has such creak sound inside of her lung. And there's something in a polyclinic which you can't confirm the your diagnosis, which is you are doing primarily. That's why when if you are working as a doctor, the best thing, if you are interested in a medicine, really it's better to work in a hospital, because hospital you can see the result of your work, and it's more interesting. And in Russia, there's such system when the patient is going, like you are visiting the patient once, and the patient cannot come back because the what's name uh, the visiting time, it can be in a different times, and she can go to the different doctors, because the appointment uh, cannot be available most of the times. There's a lot of patients, and there's no doctors, which is enough for all of those patients. That's why more interesting, it's better to locate in the hospital if you're interested in the medicine. So I hope you like the video and thumb up like the video.